Hey, what's up you guys? Welcome back to my channel. For those of you who don't know me, my name is Lauren and I am 30 years old and have been trying to conceive for about 12 months now, unsuccessfully. I'm doing a series of videos about my infertility journey in hopes that somebody else who's struggling with the same things as me can benefit from it. So if you want to hear more about my genetic testing experience, then just keep watching. So I went to a reproductive endocrinologist about a month ago, and when I was in with her, sorry, I'm sitting in front of my fireplace because it's freezing cold in here and we're about to get a snowstorm and I need to be by heat because it is like 2 degrees outside. But anyway, I went to my reproductive endocrinologist about a month ago, and when I was in her office, she asked me if I wanted to do genetic testing, and I had never even considered it. I knew that it existed, but I thought usually you did it after you were already pregnant. That's the only way I had heard of it, not before you got pregnant. And she said that it was recommended that you get tested for, I think it's Tay-Sachs and cystic fibrosis at the very least, but they can also do a greater test that has like 170 or 200 diseases or something that they can test for all at once with like one blood draw. So in the moment, I kind of was hesitant because I didn't want to like get bad news and then what do you do? But then I thought about it more and I was like, you know what? No, if I don't do it, first of all, and something like happens to the baby and I have one of the diseases that it would have screened for, I would feel terrible for the rest of my life. And it would be devastating. Second, I feel like if I didn't do it, I would be wondering and I would just go back and do it later. So I decided after a couple minutes of consideration that I would do the full screen that they offered. And there may be other screenings that offer more tests than this one. Like I said, this one tested for like maybe 200 diseases, and I think you can test for more than that, but that's what this office offered. So I was like, you know what, that's enough, that's thorough enough, let me just do that, and you know, we'll see what we find. So the way the test works is first they test your blood, and then if you come back positive for anything, they test your like spouse's partner's blood to see if they come back positive for that same disease or disorder. So it takes about 2 to 3 weeks to get the results back. So it's kind of a long wait. It's kind of nerve-wracking. And so I was driving the other day and I got a call from my doctor's office and I picked it up, and it was the nurse from my doctor's office, and immediately I knew with the tone of voice she had that there was something that came back positive on it, and positive like not in a good way, like they found that I'm a carrier for some sort of disease. So she was explaining that the test screens for recessive genes, and basically when you have a baby, you have like 2 sets of genes, and you can either give one or the other. So like for a woman, for gender, you have 2 X chromosomes, and you give, you know, one X or the other X. And for a man, they have an X and a Y, and they give either an X or a Y. And so 2 X's are, you know, female, and X and Y is a male. So no matter what, the woman gives an X chromosome, and then the man gives an X or Y, and so the man's genes are really what determine whether you have a boy or a girl. So similarly with these recessive disorders, you have like a pair of genes, and if you don't have the disorder but you carry it, you only have the gene present like in one of your 2 genes. So if you're a carrier and you are either going to give, you know, 50% chance you're going to give your like healthy gene or whatever, and 50% chance that you're going to give the carrier gene. And then what happens is if your partner also carries that same gene, it's a 50-50 chance if they're going to give like the healthy gene or the carrier gene. And if you both give the carrier gene, then the baby would actually have the disorder. If only one of you gives the carrier gene, then they would just be a carrier, and if both of you give healthy genes, then obviously nothing happens. So basically, after the nurse explained all that, she told me that I did screen positive for one disorder. She said it wasn't the common ones, it wasn't Tay-Sachs or cystic fibrosis. It was one of the other like 200 ones that they screen for. And she said the name of it, I have to look at my computer. Tyrosinemia, Tyrosinemia. And so since then I've looked it up, but I didn't really even need to, because obviously if they screen for it, it's bad, bad enough to be worth testing for. So, you know, the good news is that I don't have it, but I do carry it. So my husband needs to get tested and see if he has it. So he has to go to a genetic counselor and talk to them for like an hour before they'll even draw his blood to kind of explain what the results mean. I feel like my nurse did a really good job explaining it to me over the phone, but that's just their policy, I guess, to kind of prep you for like what your options are if you do screen positive. Both of you have the same disorder or disease, and so to kind of like prepare you for the bad news if that's what happens. So it's pretty rare. The chances of us both being carriers for that same thing are pretty unlikely, but it's possible. So obviously it's really stressful. I feel like I've already like have enough on my plate with PCOS, like basically hypothyroidism, and now on top of that there's this other thing, but at the same time, you know, it's there whether I knew about it or not, so I guess I'm glad that I know. When she first told me, I got super upset because I was feeling really hopeful that, like, you know, now that I've gone to see a reproductive endocrinologist and she gave me a prescription for Clomid, and now that I'm on thyroid medication from my endocrinologist, that like maybe I could actually get pregnant now. And I was starting to like feel like a little glimmer of hope, excitedness that I had like back at the very beginning when we started trying. And then this kind of like set all that back, because if it comes back positive, like, well, I guess the only option is IVF. I don't know. I guess like if we want a baby that has both of our genes, I think that's really like the only way you can guarantee they won't have this disorder. So that's obviously scary, because IVF was like way down the road for me mentally. And so like, I don't know. I'm trying not to think about it too much and just wait till we get some answers. So my husband was able to get an appointment, or originally I called and they weren't able to get us in until like the end of the month, and they said we both had to be there and this and that. And then I called back and I was like, you know what? I don't want to wait 4 weeks. Like, I'm really upset about this. We need to get in sooner. Like, what can you do? And so they you know, magically had some earlier appointments. So my husband's actually going in next week, and they said that I don't have to go. It's just preferred that they both, you know, spouses go together or whatever. So I'm confident that my husband can relay the information to me. And so we'll know 2 weeks after that appointment, so 3 weeks from now. So I'm really looking forward to that moment when we hear the results. I'm trying really hard to stay optimistic that everything's gonna be okay. Again, it's like really unlikely that we both are carrier for the same thing, but you know, stranger things have happened. So that's it. You know, if you have had an experience with genetic, like pre-pregnancy genetic testing, I'd love to hear about your experience, what the process was like for you, and if you both came back as carriers for the same thing, you know, how you have handled that and what you've done from there. So please leave a comment below and let me know about your experience or your thoughts on genetic screening in general. 2 other quick updates that I wanted to say as well. One, I have been taking thyroid medication for a week and a half now, and so far so good. Like, I haven't really felt any different. I maybe have had like a tad more energy, but I know that hypothyroidism makes you tired, and so it's very possible it's just in my head that I'm like, oh, now I'm taking thyroid medication and I'm gonna be less tired, and so then I've just made myself feel less tired. The medication, my doctor says, takes like 3 to 5 weeks to really fully work, so a week and a half in, I don't know that I'd really be feeling much different. But I really haven't had any side effects. The only thing that I've noticed a little bit is that I have to pee a little bit more often, or like I'll just have peed and then like an hour later I'll be like, I really need to pee. So that's, I guess, a side effect maybe, but that could be caused by other things. So who knows? But so far I feel good. No, like nothing bad to report about that. So, you know, we'll give you another update when like a few more weeks from now. So the other thing I wanted to mention is actually maybe related to the thyroid medication. Right now I'm on cycle day 17, and I feel like maybe I'm ovulating soon or might ovulate, which is very early for me. I have had like 3 to 4 month cycles the past year. So it would be amazing if I was ovulating. And again, like the thyroid medication, my doctor said might make me become regular, but at the same time, he said it wouldn't really fully take effect for like a month or more. So I don't know that it could be helping this soon or that it's gonna help with ovulation at all. But I've just had like a couple little symptoms that made me think, oh, maybe I'm ovulating. I haven't taken in any ovulation tests, mostly because one, I get lots of false positives, and so it just confuses me. And two, we got this genetic testing result back, and so like they said, don't try until you find out your husband's result, because like, I mean, you can do what you want, but like if you're both a carrier for this thing and you're in the middle of testing, like maybe hold off on trying to get pregnant just for the next couple weeks. It's been over a year, so what's another couple weeks? So we'll see if the thyroid medication is helping my cycles regulate at all. I'm excited for that possibility. Also, when we get the results of my husband's genetic screening in a few weeks, I will give you an update on that as well. So thanks so much for watching. If you have any questions, please leave it in the comments below. And like I said before, tell me about your experience or your thoughts on pre-pregnancy genetic testing. If you like the video, please give it a thumbs up, and I will see you guys in the next video.